Now, the Chris Hani Baragwanath Academic Hospital in Johannesburg has come under fire for the cancellation of nearly 900 surgical operations this year alone. This is a significant and alarming number. DA's Jack Bloom has slammed the hospital, saying it's causing patients more distress. Gauteng Health MEC Nomathemba Mokgethi has confirmed the cancellation of 870 operations at Bara. She attributes this to infrastructure challenges, among others. Well, let's get a little bit more on this now with Jack Bloom, the DA spokesperson for health in Gauteng. Mr. Bloom, good afternoon. Thank you very much for your time and for your patience while we were live to our reporter in Soweto, where the search continues for little Kaeletu Magadla. So, Baragwanath, Chris Hani Baragwanath Academic Hospital, cancelling, that means turning back sick patients who need operations, 870. Just tell us what the department has shared with you as the opposition about this.
Well, they didn't give a breakdown, but, they did mention lack of maintenance and broken machinery. And one of the preventable factors, which I feel very strongly about, is that a lot of operations were cancelled because of a lack of clean linen. Now, this is really very simple to arrange. How come after all these years, so many hospitals still have to cancel operations? And in fact, patients also go without clean linen. And this is because the hospitals have to get their linen cleaned by state laundries, which are very inefficient and they don't do the job. So the MEC for Health confirmed that laundry problems were behind a lot of the cancelled operations, and she said that there were problems with boilers and they planned to buy a new boiler. But, honestly, the simple solution is just to allow hospitals to buy from private laundries. I think that would solve the problem, and we wouldn't have all this cancelled operations, which causes immense distress both to staff and patients.
Yeah, because purchasing a boiler, it will take longer. A short-term solution, from what you are saying, and it would make common sense, is to use services of private laundry service providers who can then deal with this matter as soon as possible. But I was just wondering, last time I spoke to you, Mr. Bloom, we were talking about the impact of the delays of reopening the Charlotte Maxeke Hospital in Johannesburg fully, the impact it's having on places like Helen Joseph Hospital, and now Chris Hani Baragwanath Hospital seemingly having a large number of patients it cannot service.
Well, yes, it's our whole health service is in a crisis. And let me just spell out for you that some patients have been waiting for years. For hip and knee operations, you can wait 3 years. So imagine you finally getting your operation, you've abstained from food and drink, and they wheel you into the hospital theatre, and the operation is cancelled. Now, I also know surgeons who are terribly distressed about it. You can't go ahead with the surgery unless everything's absolutely perfect. And the surgeons tell me if it's not a shortage of clean laundry, the machinery's broken, the air conditioning's not working, umpteen problems, which I think is unacceptable, because we've got massive backlogs, thousands of operations that patients have been waiting very long time to have, and now to have nearly 900 operations cancelled halfway through the year, I think is devastating. So I would say start with the simple problems like clean laundry, which you can get from private laundries, and make sure that we don't have broken machinery, fix up the maintenance issues, and make sure that surgeons can do their jobs.
It speaks to management as well, doesn't it, Mr. Bloom, the hospital management as well? They need to be on top of these problems.
Well, I feel sorry for CEOs of hospitals when it comes to maintenance issues, because it's done by a separate department. It's done by the Department of Infrastructure Development, which is notoriously inefficient and corrupt from all the stories that we hear. So, in fact, I would like to see maintenance devolve to hospital CEOs. Let them be responsible for maintaining machinery, and let them order direct from private laundries if they need to. But, honestly, running a state hospital in present conditions is like having both hands tied behind your back, because many things are out of your hand, and it's because the Gauteng Health Department is so inefficient, and there's so much wastage, corruption and bureaucracy, and it takes so long to order new machinery or to fix machinery. I really think, this, from top to bottom, the department needs to be restructured, and staff deserve better at our hospitals. Patients deserve better at our hospitals. You heard the open letter from Dr. Tim de Meyer at the Rahima Musa Hospital. It was a cry for help. And doctors everywhere have the same cry for help. Instead, he gets victimized instead of the problem being fixed.
Yeah, maybe it's time for government to consider a new model about this. I mean, there's a case to be made for decentralizing certain functions and empowering CEOs and management of hospitals to be able to attend to some of the urgent maintenance problems they are facing. Thank you very much for your time this hour. Jack Bloom, DA spokesperson for health in Gauteng.